In the USA, dysmenorrhea may affect more than 50% of menstruating women, and its reported prevalence has been highly variable, e.g., 45 to 95%. A survey of 113 patients in a family practice setting showed a prevalence of 29 to 44%, but figures as high as 90% in women aged 18 to 45 years have been reported. In this video, we will talk about this disease, dysmenorrhea, by answering these questions. What is dysmenorrhea? What causes dysmenorrhea? Symptoms of dysmenorrhea. How's it treated? What is dysmenorrhea? Menstrual cramps, dysmenorrhea, are throbbing or cramping pains in the lower abdomen. Many women have menstrual cramps just before and during their menstrual periods. For some women, the discomfort is merely annoying. For others, menstrual cramps can be severe enough to interfere with everyday activities for a few days every month. There are two types of dysmenorrhea, primary and secondary. Primary dysmenorrhea. This occurs when you first start your period and continues throughout your life. It is usually lifelong. It can cause severe and frequent menstrual cramping from severe and abnormal uterine contractions. Secondary dysmenorrhea. This type is due to some physical cause. It usually starts later in life. It may be caused by another medical condition, such as pelvic inflammatory disease or endometriosis. What causes dysmenorrhea? During your menstrual period, your uterus contracts to help expel its lining. Hormone-like substances, prostaglandins, involved in pain and inflammation trigger the uterine muscle contractions. Higher levels of prostaglandins are associated with more severe menstrual cramps. Menstrual cramps can be caused by endometriosis. Tissue that acts similar to the lining of the uterus grows outside of the uterus, most commonly on fallopian tubes, ovaries, or the tissue lining your pelvis. Uterine fibroids. These non-cancerous growths in the wall of the uterus can cause pain. Adenomyosis. The tissue that lines your uterus begins to grow into the muscular walls of the uterus. Pelvic inflammatory disease. This infection of the female reproductive organs is usually caused by sexually transmitted bacteria. Cervical stenosis. In some women, the opening of the cervix is small enough to impede menstrual flow, causing a painful increase of pressure within the uterus. Symptoms of dysmenorrhea. The following are the most common symptoms of dysmenorrhea. However, each person may experience symptoms differently. Symptoms may include cramping in the lower abdomen, pain in the lower abdomen, low back pain, pain radiating down the legs, nausea, vomiting, diarrhea, fatigue, weakness, fainting, headaches. How's it treated? There are several things you can do to help relieve painful periods. Treatment options may include the following. Pain relievers called nonsteroidal anti-inflammatory drugs, NSAIDs, are often the first treatment for dysmenorrhea. These include medications like ibuprofen or naproxen. Hormonal medications. Your healthcare provider might also suggest hormonal birth control as a treatment. People who take hormonal medications tend to have less menstrual pain. This could include birth control options like the pill, patch, or vaginal ring. There are several treatments for menstrual cramps that don't involve medication. Some of these are using a heating pad or hot water bottle on your lower back or abdomen when you have cramps, getting extra rest, avoiding foods that contain caffeine, avoiding smoking cigarettes and drinking alcohol, massaging your lower back and abdomen, exercising regularly. People who exercise tend to have less menstrual pain. Some natural methods for relieving period pain include yoga, acupuncture and acupressure. relaxation or breathing exercises. Eating anti-inflammatory foods like leafy green vegetables, ginger and nuts, and drinking green tea. Taking supplements like vitamin D or magnesium, which may help reduce inflammation. Thank you for listening to all the information we want to introduce to you in this video. Do not forget to like, share, and subscribe for the HeInfo channel.